Hi, Dr. Roy Picard, DC with Michigan Integrative Health. This is video number 2 of a 3-part series that describes the 3 different services that we offer when it comes to chronic joint pain in the back, knee, hip, or shoulder. If you haven't watched video number 1, I would strongly recommend you watch it first, or at least immediately after you watch this video. Now, in the first video, there are important concepts that are discussed that explain why at Michigan Integrative Health we do what we do, why other offices cannot duplicate most of our services, and why we are able to get results with chronic joint pain where other offices will offer little to no benefit to you. We offer 3 forms of care for chronic pain, which are joint stability, all-natural systemic anti-inflammatory care, and care to repair damaged tissues of the body. Our all-natural anti-inflammatory care is extremely effective because it identifies specific reason that your body is creating inflammation that's going to be adding to your back, knee, hip, or shoulder pain. The care we offer is not going to be about, taking fish oil or turmeric. It's very important that you identify the cause of the systemic inflammation because the manner which this inflammation needs to be addressed will be different according to each cause. Now, we can identify causes through a series of questions, lab tests, or even a combination of both. But keep in mind that you may not even have systemic inflammation occurring to begin with, and if this is the case, then you don't have to concern yourself with this. But since your chronic joint pain has not been resolved after a few months, if not even maybe a few years, and you've already tried different types of care from different providers at different offices, it is important for you to look into this. So systemic inflammation can occur when one or more of your glands or organs are not functioning at their optimal level. As a result of this, what happens is your body chemistry will be out of balance with certain substances, or you can call it elements or chemicals, either being low or high. Now, very often these imbalances may not be so low or high that they have been given a medical diagnosis, so therefore they would not receive traditional medical care. But the lab tests will reveal that they could be more of a subclinical type of an imbalance where it's not necessarily out of the lab range, but what we really are looking for is let's say more of an optimal range that fits within the lab range. This will be referred to as a functional range. You may have heard of even some doctors who are trained in things like functional medicine or functional endocrinology or functional nutrition. So some of the more common issues that people will have when it comes to this would be things such as borderline low or borderline high blood sugar, issues with blood pressure, food sensitivities, not the allergies, but sensitivities, overgrowth of bad bacteria. You've heard of things like even leaky gut. The type of care for something like this rarely ever involves any medication, but is more likely to involve some dietary changes as well as some short-term vitamin herbal blends to help bring the function of the organs or glands back to their optimal level of function in order to minimize systemic inflammation. This type of care is not intended to replace any medical advice or medications that your primary care or specialist recommended for you. However, this type of care is going to improve your overall health as well, and it's very common to see improvements in blood sugar or blood pressure, as well as other functions of the body, to where you will periodically want to bring your other doctors up to speed so that they are aware of what's going on, and if they feel it necessary, they will go ahead and decrease your medications. We're not going to get involved in altering any dosage of your drugs. You shouldn't do so on your own at all. Wait till you have that discussion with your prescribing physician. So I hope this helps you better understand another reason as to why we are able to help so many people with their chronic pain who were unable to get the results they desired from other offices. So again, if you haven't already watched part number 1, please go ahead and do so right now. Otherwise, watch part 3, and you will understand even more reasons as to why you are still suffering in pain.